Hello, I'm here with Manny Espinoza, a wonderful urologist from Brownsville, Edinburgh. You have offices in both. We actually became friends about a year ago when he was down here or up here. I don't know where we are in the latitude from Texas, but when he was down here and we were working on penile implants together, and we did 8 implants, and he's a very high volume implanter, if not one of the top 10 in the US. And once we have these training programs, we luckily develop relationships where I learn a lot. And he had called me one day, and you had called me regarding a patient who had previous hernia repairs. And just to explain, this is kind of technical, but we just had a publication come out describing a unique place to put this reservoir in patients that either have had hernia repairs or they have hernias, active hernias. And so tell us a little bit about your experience with this midline approach to reservoir in the layman's terms.
Yeah, sure. So first of all, just thank you, Dr. Perito, for all the experience that that you have, and then you're willing to give it to us, the generation below you. So it's always nice to have that. And then also being able to have the ability to call you up if I have questions is always very good. So yeah, that was one of the questions that I had. I had a guy who came in, he wanted a penile prosthesis, but he had bilateral hernia repairs with mesh. And so, a lot of the times is, where are you going to place that reservoir? And I know you've done a lot of work with reservoir placement. And so that worked out really well. One of the things that I asked you is, what would you do? And first thing you said, I just go midline. And so
and you're like, we did a bunch of that.
Yeah. So it worked out really good. The training came in handy, and, it was just a nice little refresher to hear from you. And so basically it's a great approach, because when you do infrapubic, everything is sitting right there in this small incision. You're able to have access to be able to place your cylinders, place your pump in a great position within the scrotum, and a great placement for the reservoir. Yeah. Now, if you decide you have the traditional, which is going through the inguinal canal, you can do that. But like in this instance, when the patient has bilateral inguinal hernias, or they even have just one, a unilateral, and that's the side that you want to put it in, most likely the other side is going to be a little weak as well. Right. And you don't want that reservoir to herniate out later.
Down the road.
And so, it's just a nice placement where you go down midline, you have access to it. So you don't have to change your incision site from what you normally do, which was great. Come down, you feel where that pubic tubercle is. And here's a key, making sure the patient empties their bladder before going back to the OR. Right. I think is key, no matter where you're placed in the reservoir. So making sure that's the case, and you can feel exactly where that pubic tubercle is, and you can pop through that fascia with a nasal cannula quite easily, and you can get a nice position where you're coming up underneath that rectus fascia to be able to, and you can feel your finger that you have peritoneum below you. You got a nice placement there where you can place that reservoir in. And also the key is to making sure that reservoir is lying nice and flat, so that it doesn't want to fold on itself. And it's a nice placement. They don't feel it, and it's great. It worked out really well.
So see how smart he is. This is for the layman, but everything that he's telling you is that it's a safe, easy place to put these reservoirs. And you don't want to get a 2-piece implant, because it's never too hard, it's never too soft. You want to get a 3-piece implant where you have the ability to recreate the most physiologic erection. So it's wonderful having you back here. And we've done a bunch of work with Urofil. So Brownsville, Edinburgh, this is the guy. So thanks again for a wonderful trip.
I appreciate it.
Okay, we'll see you soon.